Thank you. Well, good evening, everybody, and welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny Committee on the 28th of September. First, I'm going to read out the housekeeping notice regarding how this Skype meeting will be managed. So please note this meeting of the committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everyone present follow these ground rules for speaking. Only speak when invited to by the chair. State your name before you speak. Mute your mic when you're not talking. If you would like to speak, please type RTS in the instant messaging panel on the left of the screen and click the arrow to send. Please note the panel is visible to all parties. If there are recommendations moved that need a formal vote, these will be carried out by the chair, asking for a response of for, against or abstain from each councillor on the committee. The regulations governing virtual meetings require all participants to hear and be heard throughout. Therefore, when voting, I will ask all participants to do so in acknowledgement that they have heard the debate and been engaged in the meeting throughout. If you don't feel that has been the case, please alert me using the chat window and abstain from voting. Should my connection be lost, the Vice Chair will take over and there will be a short adjournment agreed until connection can be resumed. And finally, can please ensure your mobiles and any other devices are switched off or put on silent and keep your background noise to a minimum. Thank you, everybody. I'm now going to ask each person participating in this meeting to state their name and role. And I'll start off with myself. I'm Councillor Karen Rampton and I am the chair of this committee. Councillor LJ Evans.
Hi, Councillor LJ Evans and I'm the vice chair of this committee.
Thank you. Councillor Hazel Allen.
Councillor Hazel Allen, member of committee. Thank you.
Thank you. Councillor Diana Butler.
Councillor Diana Butler, I'm a member of the committee.
Thank you. Councillor Jackie Edwards.
Good evening, I'm Councillor Jackie Edwards, member of this committee.
Thank you. Councillor Nick Geary.
Councillor, member of the committee.
Thank you. Councillor Cheryl Johnson.
Good evening, Councillor Cheryl Johnson, member of the committee.
Thank you. Councillor Chris Matthews.
Good evening, Councillor Chris Matthews, member of the committee.
Thank you. Councillor Lisa Northover.
Hi, I'm Lisa Northover, councillor, a member of this committee.
Thank you. Councillor Mark Robson. Councillor Robson. Okay. Councillor Roberto Rocca.
Good evening, I am Roberto Rocca, councillor and member of the committee.
Thank you. Portfolio holder, Councillor Leslie Dedman.
So sorry, Chairman, for that delay. My fingers went totally dead the moment you spoke. Leslie Dedman, councillor and portfolio holder for Adult Social Care and Health.
Thank you, Councillor Dedman. Louise Bate, Health Watch Dorset Manager.
Good evening, I'm Louise, I'm the Health Watch Dorset Manager.
David Vitti.
Good evening, David Vitti, Director for Adult Social Care Services.
Thank you. Phil Hornsby.
Good evening, committee. My name is Phil Hornsby, Director for Adult Social Care Commissioning.
Thank you. Mark Harris.
Good evening, everyone. My name is Mark Harris. I'm Head of Mental Health and Learning Disabilities for Dorset CCG.
Thank you. Barry Crook.
Good evening, everyone. I'm Barry Crook. I'm the independent chair of the Safeguarding Adults Board.
Thank you. Claire Hughes.
Hello, I'm Claire Hughes. I'm the business manager for the BCP Safeguarding Adults Board.
Thank you, Claire. Pete Courage.
Good evening, everyone. I'm Pete Courage. I'm Head of Strategic Development in Adult Social Care.
Thank you. Chloe Durrant.
Good Good evening, I'm Chloe Durrant. I'm a Principal Research Officer in the Insight Policy and Performance team.
Thank you. Sally Sandcraft.
Good evening, everybody. Sally Sandcraft, Director of Primary and Community Care for Dorset CCG.
Thank you, Sally. Joe Tyler.
Good evening, I'm Joe Tyler, Democratic and Overview and Scrutiny Officer, and I am clerking the meeting this evening. Thank you.
Thank you. I think we also have Max Reed, but he's more in the background, I think, Max. Okay, I will now move on to the agenda items for this meeting. The first item is apologies. I'll ask Joe if there are any apologies.
Thank you, Chair. So we have received no apologies from councillors for this meeting, but just for the purpose of the live stream and members of the public and officers here, we do have apologies from Jan Thurgood, who is the Corporate Director of Adult Social Care. Thank you very much.
Thank you, Joe. Item 2, substitute members. Are there any substitute members?
Again, Chair, there are no substitute members for this meeting.
Thank you. Declarations of interest. If any committee members have any declarations of interest, please indicate them by typing in RTS in the conversation panel on the left of your screen. I think Councillor Allen's coming up with something. Councillor Allen?
I'd like to declare that I'm employed by the Royal Bournemouth Hospital. Thank you.
Thank you. Are there any other declarations of interest? Councillor Johnson.
Thank you. I'd like to declare the same. I'm employed by Royal Bournemouth Hospital. Thank you.
Thank you, Councillor Johnson. Are there any other declarations? Okay, not seeing anything there. So moving on to the next item, which is confirmation of minutes. These are the minutes of the meeting held on the 27th of July. And unless anyone indicates otherwise, I'll assume that the committee agrees to confirm these minutes as an accurate record. I'll give you a minute. Okay, I'm not seeing any disagreement with that, so I'll assume that those minutes are confirmed. Thank you. Going on to item 5, which is the action sheet. And I think we had a couple of items. From the committee meeting on the 2nd of March, we had the big plan. I'm going to call in Joe Tyler, because I think you've got an update for us, Joe, on that item.
I do, Chair. Thank you. I just wanted to bring us back. Item 5, public issues. I think we may have just skipped over that one.
Oh, I do apologise. I've got that as item 6.
Oh, well, we should cover it either way then. But
to that next.
I can confirm, Chair, on that one, we have not received any public issues for this meeting, so that will deal with that. But in terms of the action sheet, yes, as always, it's best practice to keep an action sheet as a record of all of the actions that come from previous meetings of this committee. So as members will have seen, the only item that has not been fully actioned as yet is the big plan. And that was for members of the People First Forum to attend and possibly contribute at a full council meeting where the full council will be considering the Bill of Rights Charter for the People's First Forum. With this, discussions have been held between relevant officers on how and whether this could practically be conducted during the COVID period with the use of virtual meetings, and also what our constitutional rules are when it comes to external participation at council meetings at this point in time. So I understand that the officers are actually looking into the possibility of a separate all-councillor seminar that will be conducted by the People First Forum. However, no date is set as yet, but conversations are still ongoing with that one. In terms of all of the other items on the action sheet that were from the last meeting on the 27th of July, they have been actioned as is shown on the sheet, and they will therefore be removed from the next iteration of the action sheet at our next meeting. So thank you very much, Chair.
Yes, thank you, Joe. Just on the big plan, do any members of the committee have a comment to make on the suggestion of having an all-member seminar? If you have, can you put RTS? Councillor Dedman, is this about this issue?
Yes, it is, Chairman. But it was only to endorse what's been said. And yes, I do hope that the members of the committee will approve that idea, because I think it's going to be really, really valuable. So thank you.
Thank you. Any other comments? One of the items on the action sheet was a suggestion from a committee member to receive a brief monthly email update on the COVID-19 adult social care response. And I believe that all members of the committee have received this. We are obviously not going to be discussing it this evening. There's a lot of information in there, and I'm not sure that we have public health present. So if there's anything, any brief comments to be made, I'd be happy to hear them. Is everybody happy with the format and with this monthly update suggestion? Oh, we have Director of Public Health is here this evening until 7:15. So if there was anything in particular that MD wanted to bring up, I'm sure that Sam would be able to help us with that. But it sounds as if everybody's quite happy. Okay, thank you very much. So moving on, we have item 7, which is the Learning Disability Annual Health Check Programme update. And I'd like to welcome Mark Harris. And if you have a question or a comment following the presentation, please put the RTS in the conversation panel. Mark, if you'd like to take us through the presentation, thank you.
Okay, thank you, Chair. So within your pack, you would have received a paper just outlining sort of the latest position around it. What I'm proposing to do is just to quickly go through that paper, just hitting out some of the key points, and I'm happy to take questions afterwards. Just in the background to learning disability sort of annual health checks, obviously they're a key sort of feature of the NHS long-term plan, and they do feature within our local Dorset learning disability and autism programme plan going forward. Unfortunately, due to COVID-19, we've had quite a big impact on sort of our delivery of that. And that's not to say that we've been challenged over recent years as it was with annual health checks, but in light of COVID-19, it's had an additional impact in that it's been very difficult, obviously, to continue with those health checks during the period of lockdown. What I'm pleased to say is, as part of the phase 3 recovery planning, it's been highlighted as a key sort of priority across the whole NHS to sort of make sure that we pick up as much as we can and catch up on those learning disability health checks as part of the Health Inequality Programme. And a target of 67% has been set to try and achieve by the end of this financial year. Normally that's 75%, and that's something that obviously we would be trying to achieve by the end of the long-term plan, which is 23-24. The current position at the moment, I've given a quick sort of summary of where we've got to in the last year or so. For last year, we did manage to sort of complete just over 2,000 annual health checks, which was 54% of the population, and that was across Dorset. For the BCP conurbation itself, we actually hit a higher rate, which was just close to 60%. Obviously still not to the sort of level that we wanted to, but it was moving in the right direction. Now, what we have tried to do sort of is look at where we've got to through Q1, which was the main sort of position that was hit by the COVID pandemic, and obviously the stepping down of some of the services. We did manage to complete 123 health checks through that sort of period, albeit there were 73 of those were in the BCP conurbation. And what we've done now through the sort of priority work for the phase 3 components of the recovery is to set a trajectory to try and achieve that 67% threshold. Now, those numbers that are in the table, I appreciate, are across the board for Dorset. We haven't quite got down to sort of saying how many sort of in each of the GP practices. However, we're working with each of the GP practices to sort of get up as high as we can on the number of checks that they would complete. So in section 3, it outlines a number of the actions that we're taking forward. So you'll be familiar with the development of primary care networks. Within them, there's a number of those that have chosen the LD annual health check as a sort of key priority as part of their sort of local improvement plans. So we're working with those particular ones. Within the BCP conurbation, I believe there's 3 or 4 PCNs that have chosen that as an area of priority, so we're working directly with them. We have engaged with a number of other stakeholders as well, including Healthwatch, which are on the call, who have offered support, and we're working with the Learning Disability People First forums to support us with working with primary care to make those reasonable adjustments and to enable people to come in to get that health check. The other key thing that we're looking at, which will help really, I think, and one of the challenges we've had in the past is the visibility in how many checks have been undertaken. So data is quite a big important part of this, in that we need to sort of have that visibility of sort of when health checks are being complete, who's due one, and that's something that our CCG business intelligence team are now helping us to develop. And then the 3.5 there talks about a dedicated task and finish group, which ties into that stuff around the quality improvement plans, or local improvement plans for each of the PCNs. That's where we'll be working with them and to build those relationships across with the community LD teams as well. And the other important factor and feature to mention on this really is it's not just about the health check, it's obviously about what happens after the health check as well. And one of the areas that we're keen to do is to link in with Public Health Dorset to sort of look at how we sort of tie into the Live Well Dorset offer, really, to sort of make sure that any sort of needs that are identified through the health check process are picked up as relevant for Live Well. So the next steps around the next few months really are to continue that work through and to start building a platform as well where we can get GPs and practices to share good practice. So again, we're aware that across the conurbation, some practices are doing it differently to other practices, and we want to sort of really share that good practice and good experience. So we start to get everyone sort of moving in the right direction and working consistently in their approach to it. Another key one is around how we can combine that with the flu vaccinations, which will be another key sort of aspect, especially in the current climate for this cohort of the population. And again, building on that dialogue with Healthwatch and other partners is to sort of make sure that we can actually get the message out there. So again, using sort of the Learning Disability Provider Forums, which are facilitated through the local authority, to sort of really encourage those providers to make sure that people are accessing primary care for their annual health check and sort of using their Yellow Health Book as well to sort of facilitate some of that work as too. So again, it's taking it from a number of different facets really and targeting it so that we get the message out there, the importance of people coming in to get them done. So just in conclusion, as I said, that it's still a key priority for us, and it's something that will continue to remain so. We've got a dedicated lead and dedicated work stream, which is moving that forward. Really good engagement with our primary care networks who are keen to take this forward too. And it's really just to ask members to note the work programme and associated plans. Thank you.
Thank you very much, Mark. Do you want to just sort of mention to committee members what the Yellow Health Book is? It might not be a familiar term.
Sure, yeah. So the Yellow Health Book is a handheld personal health record, which was developed specifically for the learning disability population. So again, that was co-produced through our Learning Disability Health Action Group, which is a subgroup of the Learning Disability Partnership Board. And within that, it has some key sort of an easy read record basically for people to hold and take into their sort of health appointments. So it's not just for GPs, it's for hospital appointments as well. And the idea being that actually that record can stay with the person and they can bring with them, it will have some communication aids within that as well to sort of help whoever the healthcare worker is to understand how they might interact with that individual when they come in.
Yes, thank you for that explanation. I'm going to bring Councillor LG Evans, but before I do, I must make an apology to our portfolio holder, Councillor Dedman. I did have you down to give your update at the after the action sheet update, so I will bring you in after this item. Do we want to also discuss the conversation that Councillor Edwards and Sam Crowe have been having in the bar before we take some questions? Councillor Edwards, would you like to deal with that?
Thank you, Chair. I just asked Sam Crow how we were doing locally with our students as they returned here just over a week or so ago, because we've seen on the news the student problems in the large universities, in our large cities, where many have tested positive and had to stay isolated in their halls. And Sam very kindly answered the question, but he could probably sort of say it out for the public that are listening. Thank you.
Thank you, Councillor Edwards. Thank you, Chair. So just to recap on what I put in the sidebar, we've been working closely with all three of the universities on their preparations for the new term. They all have outbreak management plans, and we've been working through those through our Health Protection Board. And so far, we're not aware of the sorts of issues that affected some other universities like Exeter, Manchester and Glasgow. But we are preparing for the likelihood of students testing positive at some point. And because of that, we're arranging for additional testing capacity. And that would be potentially one of the mobile testing units parked up quite close to the Lansdowne and Talbot campuses, particularly for any students that might find it difficult to access the regional testing site at Creekmore. So far, so good, but we're not taking the situation lightly.
Thank you, Sam. Councillor Evers, are you happy with that response? Do you have a supplementary?
No, I don't. Happy with that. Thank you, Sam.
Thank you. Councillor LG Evans.
Great, thank you very much. Mark, obviously numbers are very, very low for the learning disability health checks in the first two quarters, as is completely expected. But table 1, I think it is, paragraph 2.8 on page 21, is quite optimistic as to how many health checks are going to be done in quarters 3 and 4. My concern is it's not taking into account the possibility of a second wave and how we're going to mitigate for that. So I'd be very interested to hear your thoughts, please.
Yeah, thank you. Yes, it is optimistic. It is a challenging target, and I guess one of the things that's been set to us as a system is to try and achieve that sort of catch up, I guess, rate over the year. I mean, traditionally, obviously the quarters 3 and 4 have traditionally been higher than all the other quarters. So the way that the system has worked in the past and the way that the GPs do it, it tends to come through sometimes in quarter 4 more often than not, where we have the sort of large majority of health checks undertaken. I guess, I mean, you're a GP yourself, I think, aren't you? So sort of you might be familiar with that. I mean, under the QOF framework, that tends to be sort of how things have worked through in the past. What we are trying to do is level that out a little bit. Obviously, with this year, it's all sort of been thrown up in the air a wee bit. In terms of the contingency plans, I mean, I guess it is very difficult for us to make a specific contingency plan for this at this moment in time, given the risks to this population cohort that COVID actually present. We have looked at work. There's been some national guidance that has come down, which talks about sort of looking at some of the checks that are within the health check that may be able to be done virtually, which we are sort of exploring. It is a challenge, and we've been having regional conversations with colleagues and other sort of systems across the southwest around how we might be able to sort of facilitate that sort of in a virtual means. It's not easy, and being 100% sort of honest and stuff, I think we will have to take it as it comes, because we're not sure yet as to sort of the impact that how any future sort of outbreak might have on primary care. But also, I guess what we need to make sure is that the individuals that are sort of at the heart of this with a learning disability are not put any additional risk. We do use the PPE, so where there's a need for someone to have an annual health check, one of the things that we have sort of sought to do is look at how we might risk stratify some of these individuals. So those individuals that might be at highest risk would be the ones that we would sort of try to attempt to get a health check completed with. So again, that's working within that working group that I referenced before, is actually thinking about how do we go about that, what do we use as a risk stratification tool for it, and I guess that would be the main mitigation really.
Okay, thank you. Councillor Jana Butler.
Thank you, Chairman.
Yes, going on the learning disability annual health check, it's good to hear that the university students are having mobile units. I know this has been mentioned before in a previous meeting. Would it be possible to have mobile units for people with learning disability as well, especially in high density areas?
Sorry, is that in regards to the health checks?
Yes, to health checks. Thank you.
I mean, it's not something that we've sort of considered previously. I guess what we're trying to make is primary care settings accessible with reasonable adjustments, working with the community learning disability teams and other partners to facilitate that. At the end, I think where we can, we will take people out to sort of home visits and to care homes where necessary. There is an enhanced care in care homes program as well, which will pick up some of these individuals where they're moving into sort of the realms of a learning disability population. As I say, it's not something that we've considered at this moment in time, but again, through the sort of dedicated task and finish group, we're looking at some other areas and sort of looking at sort of what is best practice, and we will feed that in then to the sort of program as we move forward.
Thank you.
Councillor Jackie Edwards.
Thank you, Chair. We've been told to encourage the general public to have flu jabs this year. I presume those with learning disabilities, are they seen as a priority for flu vaccinations?
I'll need to go back and double check, but yes, they would be deemed as being at the risk on the risk cohort as far as I understand, but I would need to go back and double check and come back and confirm if that's okay.
Yes, no problem.
Thank you. Sally Sancroft.
Thank you, Chair. I might be able to help with the last question as well, but just to pick up Councillor Butler's point, I do remember, Councillor Butler, you raised this before about the mobile units for health checks for people with learning disabilities, so we will definitely feed that in. I think what we're trying to do is have a bit of a menu of options for people, because I think depending on the nature of some of these learning disability, we want to take it away from being a medicalised model. So we want to be able to engage with people in more of their home, as Mark said, and their social settings. So we need to be flexible with that, and that will be a major part of the programme, about adapting how we approach things and not always expecting people to come to the GP practice. That might be fine for some, but not for others. In terms of the question around flu, as you probably aware, people with learning disabilities can also be more prone to having other long-term physical health conditions, and therefore if they do have long-term conditions, they will potentially come into the high-risk group and therefore would be in the category for prioritisation for flu vaccination. So it depends on their associated physical conditions. Thank you.
Thank you, Sally. I've got a question again. It's about the flu vaccination, and I know that the next steps are to try and have flu vaccinations combined with health checks, which makes absolute sense to me, except that it's a bit late to sort of kick that off. Presumably that's not for this year, that's for next year, because the vaccination programme has already started.
No, it is for this year, and I guess it's tied in with that recovery phase planning letter that we received not so long ago, really. I guess we will take the learning from this year into next year and future years upon that, moving on from that. I mean, this is part of the conversations that we're having with primary care, and just picking up Sally's point around sort of, if someone is having an annual health check, it creates that sort of additional opportunity to engage with those individuals, especially where we're going out to sort of people's homes and other settings, and they're not necessarily coming into flu clinics as such for those jabs. So yes, it is a priority that's outlined for this year, not just for next year.
Yeah, thank you. Are there any more questions or comments? Sally?
I think that was my RTS from last time.
Oh, right. Thank you.
Thank you.
Does anybody else have a comment or a question? No? I don't think so. So thank you very much, Mark. And we are being asked to note the information and the next steps outlined in this report. I believe we're seeing you again next March for an update on employment opportunities for people with a learning disability, as well as a health check update. So we look forward to that. Thank you very much. Rita, are you content that we've noted the information and the steps, and can we move on? I'm not seeing any dissent with that, so I'd like to bring in Councillor Leslie Dedman, and again, apologies for missing you out earlier.
That's no problem, Chairman. Yes, I'm glad to be able to give you a bit of an update. We've held an all-member seminar on the local outbreak management plan, which I was really, really glad to see most of the committee at, I think all of the committee, in fact. And that was really valuable because it placed before members the plans, obviously. But I think we were able to brief all the ward members on the expectations and the importance of using BCP communications, because we must be so careful to give out the proper information to residents. So I think that was really, really a valuable seminar. Oh, excuse me. And we had the Health and Wellbeing Board on the 3rd of September. That's chaired, of course, by the leader. And this board is not only the two portfolio holders, adults and children, and the officers, but we have Poole and Bournemouth hospitals there, Dorset Healthcare Foundations, the Clinical Commissioning Group, and a representative from Health Watch. And also we have Karen Loftus, who I think some of you know, who's from the Bournemouth and Poole Voluntary Services, who's very, very useful, and the Fire and Police Services. And at that particular board, we had a very interesting piece, which I'm sure the committee are all familiar with, on the safe and well checks. They've been going on for a while, but in fact they are a fantastic and really long-lasting initiative. And obviously at that board we were briefed on the pandemic, which is ongoing. Oh, excuse me. And we've had a joint Safeguarding Adults board meeting, which we will hear about later. And there's been a huge amount of work completed on that board to improve the linked up working. I think it's called joined up working, isn't it? I don't know all these phrases, although I'm starting to learn them. And again, like the Health and Wellbeing boards, the makeup of the safeguarding it ranges from our own portfolio holders and our own officers. It's got Dorset Clinical Commissioning Group, Dorset and Wiltshire Fire and Rescue, Dorset Healthcare NHS Foundation Trust, the Probation Service, Dorset, Devon and Cornwall Community Rehabilitation Company, Dorset Police, NHS England, and NHS Improvement South West, as well as Poole Hospital, Bournemouth Hospital, South West Ambulance Services, and members of the voluntary sector and representatives of independent providers. Chairman, I'm saying all this because I think it's really useful to know how big these boards are and how wide they span. And to get them all round a table or on a screen is quite a task. And the achievements of this board are getting clearer as we go on. And it's very clear that one effect of this pandemic, which is a good one, I think one of perhaps the only, is the acceleration of the actual joint working of all these partners that I've just mentioned. And that's now really excellent. It's really cut through everything, and the working together now is very, very good. There was another board that I attended, which is I think almost quarterly, I'm never quite sure. It's the adult lead members for the South West, although it goes from Swindon right down to Cornwall, so it's quite a big southwest. And these meetings again are very useful because they give a guide on how other councils are managing. And of course the pandemic has more or less taken over the discussions. I mean, we have all got differing views on good practice post-COVID. However, it really is interesting to see other people's ideas and also their preparations for a second wave. And also, at this particular meeting, the potential impact of Brexit on everything. And there are varying sizes of council. As I say, they go from Swindon down to Cornwall. But the main thrust is to get the best practice. And I find that a really, really worthwhile meeting to attend. I'm going to finish by mentioning Tricuro because the executive shareholder group, we've had several meetings during this period because we're working to place a permanent chief executive for Tricuro, and of course that's only joint with Dorset Council, so that's quite a small board. And Chairman, I know you're well aware of all this and what the work encompasses, but I did want to just put this before the members because you might not know how wide we range at BCP and how influential the work of the council is. Chairman, I won't go on much longer. Thank you very much for letting me speak, and I'll put my microphone off. But if anybody's got questions, that will be.
Thank you very much, Councillor Dedman. I do well remember going to the Adult League members' Southwest meetings, and they were always in Taunton, which was always an absolute pain to get to and back from on a Friday. So having sort of virtual meetings must actually be a great boon. And I remember we used to say frequently, why are these meetings not virtual? So I'm glad that they finally worked out the technology.
Well, absolutely, Chairman. I totally agree with you because although I'm very fond of Taunton, it's a long drive and a long train journey. So yes, I think you're very, very right.
Members, are there any questions or comments for Councillor Dedman? I'm not seeing anything. Councillor L.J. Evans. Great update. Yeah, thank you. Thank you very much for that. Right, we're going to move on in that case to item 8. And item 8 is the Joint Business Plan 2020 to 2022 of the Dorset, Bournemouth, Christchurch and Poole Safeguarding Adults Board and the Annual Report 1920 of the Safeguarding Adults Board. So I'd like to welcome Barry Crook and Claire Hughes. And again, members, after the presentation, if you have a question, please do feel free to put RTS in the conversation bar. But for now, I'll hand over to Barry and Claire. Thank you.
Thank you very much, Chair. I wonder if I could take the presentation in two parts and begin with the annual report, because that flows logically then on into this year's business plan after you've heard some of the issues that were raised during the annual as part of the annual report. The annual report starts at page 37 in your papers, and there is a lot of information in here. So what I'm going to do is draw out points from my introduction to give you a sense and a flavour of the work of the board, and then we'll happy to take some questions about any specific issues that you may wish to raise. And then after that, I'll speak to the business plan, if that's okay, Chair. I started my introduction this year by mentioning the independent report that the board commissioned from an external consultant, which was primarily to look at evolving structures for governance around safeguarding. But because the consultant was previously an Ofsted senior manager, we also got quite a good in-depth summary of how well he thought the board was working, having talked to many of the members and partners. There was a lot of positive practice that was drawn out. The work of the subgroups was felt to be very useful. Very complimentary comments about the policy and procedures that are maintained regularly and updated every year. And some positive comments about the follow-up of reviews and the action plans that we implement in order to make sure the learning from reviews is put into practice. Where he felt we ought to be doing better was in what was termed line of sight, in terms of understanding actual performance better on a day-to-day basis. And he also felt that our meeting structures, with having two separate boards in the county, were causing some duplication and overlap. He didn't actually produce a more definitive governance model for us to take forward in the light of local government reorganisation and changing safeguarding practice. So that is something you'll see that is continuing into this year's business plan. Domestic abuse is one reason why there is a need for us to relook at the governance of the safeguarding environment, really. And as Councillor Dedman has said, we do work closely with other partnerships, but there is a need for a more overarching governance structure, I think, for safeguarding and community safety, which enables better strategic planning to take place, and also operationally for staff to know better how they need to work across the different themes. And different reviews that we have received in the past and are still receiving suggest that we need to integrate better safeguarding, MARAC, MAPA as well for serious offenders, and our own multi-agency risk management meetings, MARMS. So an individual could be caught up in more than one of those processes if they are someone in need of care and support who is suffering domestic abuse. They could be subject to MARAC. They could also be involved in safeguarding in some way. The message is that we certainly need to work harder in order to improve how we work together across the partnerships, both strategically and operationally. COVID-19 doesn't feature strongly, of course, in this report because it was looming over us at the end of March as we concluded. But I wanted to make the point of how we keep in contact with providers. And each year we do run an event for providers and voluntary sector agencies to update them about safeguarding, to help them to contribute to our business plan. And in the annual report, you'll see details of a successful event we ran again, looking at informing them about liberty protection safeguards, which are now being put off for a couple of years, but also trying to get across and look at the issues around how you help individuals with care and support needs to build healthy relationships. And this was particularly important this year because councillors may remember from last year we reported on a safeguarding adult review into the death of a young man with a learning disability who was murdered by two of his friends, or so-called friends, where he had been in a relationship. The Safeguarding Adults Review was published in March of the previous year, but it's important, it doesn't stop there. And it is a real role for the Safeguarding Board to disseminate this more widely and to make sure that the action plan is getting completed and some real results and practices changing to take account of the learning. So we have run a very well attended event for staff across a range of disciplines, examining the learning in this case. As I said, we communicated to providers and got them to think about how you support people with a learning disability to maintain healthy relationships. And we also worked with the Learning Disability Partnership Board and People First Forum to run an event for service users, which was quite striking in that when I arrived at Poole Civic Centre for it, there were queues out the door of people wanting to come in. And I think it made quite an impact on many of the service users and carers who came to look at issues around personal safety for people with who are vulnerable through their learning disability. And we've also worked with People First Forum to produce an easy read version of the review so that is live and on our website. Chair, I just wanted to pick out those kind of highlights and issues. But as I say, if there's anything in the report that members would like to ask about specifically before we move on to the business plan, either about what we've done collectively as a board or about the work of individual member organisations, which is represented in the plan, the report, then I'd be happy to take questions at this point, and Claire and I will help as much as we can.
Thank you, Barry. I've got Councillor Diana Butler showing first.
Yes, thank you, Barry. That was really good. I really enjoyed reading the information, and I wanted to point out what an excellent piece of work the leaflet is, keeping adults safe. I feel it would be a great way to advertise what is going on to everybody, really. And I'm wondering how far spread this will be used. You know, will it be used as posters, leaflets to give out to lots of different people and carers as well?
Perhaps I could invite Claire to comment on that as she handles communications for us.
Hello. Yes, the Keeping Adults Safe leaflet is currently available on our website for anyone who wants to use it. It's also been shared widely with all of the partner organisations that Councillor Dedman was list in earlier for us. And over the recent months, I was also working with People First Forum. We did, before lockdown, we managed to get in an event where we worked with people with learning disabilities to co-produce an easy read version of that. Is also just ready for publication this week. So I suppose the answer is that the Keeping Safe leaflet can be used by anyone and can go as wide as you'll help us to share it, really.
Thank you, that's fantastic.
I think you're muted, Councillor Rampton, but I think you said Councillor Evans there.
Sorry, I did. Councillor Evans, sorry.
So yes, you mentioned early on in your presentation, Barry, about the findings over perhaps people on the boards finding the data quality quite difficult to interpret, and that more needed to be done on that. And also that whilst one joint meeting has been trialled, there have not been any sort of specific plans put into place as to how that's going to work going forwards. So I just wondered what's happening there, please.
In terms of board meetings, style of board meetings?
Yes, in terms of joint working between Dorset and BCP.
Yes, well, we have actually had three attempts now. One which was the last face-to-face meeting in March, where we tried a tripartite system of each board having a separate meeting and then having one in the middle together. Business was paused a little because of the pandemic, and in July we met again, but as separate boards. And then last week we had a similar virtual meeting where we did the tripartite approach again. So I think we're now at a time where we can reflect on that and say, how did this work? Because we've done it both in person and virtually. It's a very stressful meeting to chair, I have to say, when I've got three of them in very compressed time trying to get through the business. But I think it's given us a feeling of what we need to work together on and what is more of a separate issue, which may be locality based, that may enable separate boards to look at more closely. But there are meetings in the diary this month for us, both in Dorset and in BCP, with officers to look a bit further at how do we progress the project around safeguarding governance.
Great, thank you. And any comments on how better to provide data analysis so it's just a bit more accessible?
I'd hoped we'd improved it for you this year in terms of the presentation of data, but in terms of analysis of data, yes, I think there is work to be done on that as part of the review. Because you may be aware, for example, the Community Safety Partnership has some dedicated analysis capacity and produces a very large assessment of need each year. The Safeguarding Board doesn't have that level of support. So I think if we're going to really drill down into our data better and relate it to what's collected by other partnerships, we will need to build that into future resourcing for both boards, in fact. But I'll say a little bit more about what the Quality Assurance Subgroup is doing this year when I get to the business plan.
Thank you, Mary. I've got Councillor Hazel-Allen, please.
Thank you. I noted in your report that you mentioned safeguarding around rough sleepers and people that are homeless. I'm just wondering who is the lead around safeguarding for this particular group. I know that we have brought a lot of rough sleepers into emergency temporary housing, which is very good, but I'm also aware that we have put a lot of people together very, very quickly, and there have been some issues around vulnerable females, some issues around some of that provision being infiltrated by drug dealers, and obviously there's also the ongoing issues with cuckooing, which there's been quite a lot of reports of. So I think that I'm aware that although we've done some very positive work around homelessness through COVID, we have to be very aware that because everything happens very rapidly, that we're got a very close eye on safeguarding as well. Thank you.
Yes, I think that's right. I mean, prior to COVID, we had undertaken not a safeguarding adults review, but a less formal review of 2 homeless men who died, and discovered that actually there was a good range of services looking out for people. But we're very aware that things have changed a lot as a result of COVID, and those kind of issues, risks to people who were homeless, who are now housed, are perhaps arising in a different way. And so safeguarding for the homeless is something that's rising up the agenda nationally and not just locally. And you'll see that that's an element of the business plan as well, to review what are the issues around risk management when you are trying to quickly, temporarily accommodate different people who've been on the street for quite some time.
That's very helpful, thank you, and it'll be interesting to see that work coming forward.
Thank you. Councillor Jackie Edwards.
Thank you. How do you engage with people who are self-neglecting or hoarding? I mean, especially if they don't recognise there is a problem, and if you do manage to help them, are they then subsequently checked to ensure that they don't go back to self-neglecting at a sort of later date? Thank you.
In a way, that's a question more for a skilled practitioner than for someone who leads a board, to be truthful, because we have asked the same question ourselves and invited practitioners to come present to the board some casework that they've undertaken with people who self-neglect, and had a couple of very interesting presentations about that. There is also a self-neglect and hoarding panel being set up, which will receive referrals and I think provide advice to practitioners about dealing with this group. It's not I can't really answer your question in great detail, and there'll be others much better qualified than me, but I think again it's a growing area of concern, because some national research into reviews is showing that self-neglect comes up very highly as a reason why we need to do a review of someone who's died. So it's a very topical issue, but one where staff are building their skills, I think.
Thank you. And I believe sometimes you can run into data protection sort of data issues, really, you know, especially if people don't want to engage.
Well, there are some very important issues for practitioners to resolve in terms of capacity and assessment under the Mental Capacity Act in that respect, both in terms of any actions they want to take, but yes, also how far they can share someone's data if they don't want that, personal information if they don't want it to be shared.
Thank you.
Barry, I had an interest in I have residents in my ward who are hoarders, and I thought the hoarder panel was actually already set up and running. I think, did you say that it's going to be set up?
I thought it was set up, but I mean, others may be better informed than I am, but I didn't think it had met yet, but I may be wrong.
I thought it was quite interesting in your report where it said that there's often an assumption that somebody who hoards has a mental health problem, but that isn't necessarily so. And I think that's a bit of a public perception, isn't it? That if somebody hoards to such an extent, that they do have a mental health problem. So that was very interesting. It's a very good report all round. Can I just ask you a question about the financial implications, please? You've said that the board is funded by member organisations. Is that, how does that work? Is that sort of evenly spread across all the partner organisations, or does the council bear the majority of the costs of running the safeguarding boards?
It's not evenly spread. In all safeguarding adult boards, the local authority, the CCG and the police generally provide the bulk of the funding in different proportions. We do receive funding from the 2 hospitals and from Dorset Healthcare, not from the probation service, I'm afraid. I'm sorry to say, given my background. So that is one of the things that needs to be reviewed as part of the governance review, because it's not been reviewed for many years, and I think we need to go kind of do a zero-based budgeting exercise and ask ourselves, well, how much resource does the board need in order to do its job well, and how should that be divided between the partners who have an interest in it?
Yes, I think you're absolutely right. I think it does. A review would be very timely. Councillor Edwards has said, do we get minutes or updates from the panel? And I think Claire's responding in the chat bar. Right, okay, thank you. Thank you, Claire. Are there any other questions or comments before Barry goes on to the business plan? Okay, and we're waiting for David to type a message. Okay, would you like to carry on, Barry?
I will. I'll just shut my video off a little bit while I go talk for my notes. As opposed to the annual report, which is solely for our BCP, the business plan is a joint plan with both boards, BCP and Dorset. And you have had a copy of the plan, but there's a more detailed work plan that lays out some of the actions and the timelines that are going to be supporting the priorities that I've set out in the paper that you have. Inevitably, in the introduction, I've had to mention COVID because that's delayed us inevitably getting the plan together. It also has the potential for the actions that we're trying to set out and achieve to be delayed as well and to take longer to complete. So this plan is really a 2-year rolling plan with the opportunity for regular reviews of priorities as we go through the rest of this year and next year, so that we can be flexible and take account of the potential problems that a further outbreak of COVID could cause. It's also a plan where we've actually said we need assurance from other partners because of the work that they're undertaking in respect of key issues for adults with care and support needs. So that may be another partnership such as the Community Safety Partnership, or it may be individual board members, organisations themselves, where we need to know what actions they're taking in order to support a particular group, which might be in respect of exploitation, for example. If I just work my way through the different headings of the priorities briefly for you, so given that so many of our referrals for concerns come from the adult care sector, there obviously is a lot of concern around the care sector and potentially avoidable deaths that may have taken place in the care sector and what is being done to support it. And you will know there from your briefing that there is a lot of work being done to support particularly care homes in respect of the pandemic. The board hasn't looked at this in detail yet, but we are planning a reflective learning event next month where we will look in more detail at what has happened so far to try to evaluate the positive impact of lessons that have been learned about keeping people safe in care homes, and also to assure ourselves that the planning for the winter months is actually building on the learning that has been addressed. We've not had any referrals for a safeguarding adult review yet of a death in the care home from COVID, but I suppose I must raise the question, should we have? We know that one safeguarding adults board in the Midlands is undertaking a safeguarding adults review into a care home where there are a number of deaths and clear evidence of neglect. I'm not suggesting that is happening here, but it's the right time for the board, I think, to have to evaluate and ask that question as we analyse what has been done well and what opportunities may have been missed in the first part of dealing with this very difficult pandemic. If I move on from that, there are continuing priorities from last year which we are building upon. So I've already mentioned domestic abuse and the need to have a better integrated whole system approach to how we manage and work with people subject to domestic abuse. But we're also becoming more alert to the wider extent of domestic abuse in respect of different groups of people. So at the moment, there is a safeguarding adults review in Dorset where that involves two older people, one both in their 80s, where there has been domestic abuse over a period of time. And we have just received a safeguarding adults review stroke domestic homicide review into the death of step-grandparent at the hands of his dead grandson. So we need to be more alert to the wider range of groups of people who are affected by domestic abuse, as well as working together much better as a whole system. Neglect and self-neglect, we've already touched upon this. And neglect is the biggest numerically concern raised in safeguarding. But it is broken down into lots of different categories, and until we understand better what those are, it's very hard to actually target how we may prevent neglect. So it may be about medicine management, or a carer not following a care plan. There may be other causes of neglect. And we need to actually break this down and find out locally more clearly how we can influence and try to prevent neglect and self-neglect. And that work is going on both locally and in the quality assurance subgroup, which is across both boards. We're also undertaking an audit of our multi-agency risk management meetings. There are a very large number of meetings being held, which have many positive features as people come together to analyse and assess the risk that people face. But we've not yet actually taken stock and said, well, are they producing better outcomes? And are they working in the way that we originally intended? So that's a piece of work that is also going on currently, and we wouldn't expect to have the results of that for the next board meeting in December. I touched on the governance review already in questions about the annual report. It was understandably paused during COVID, but I think we do need to regain momentum. I think many people have a sense of what needs to be done and what they'd like to be done, but it's important that we have consent across partners and work on the detail of how we may restructure different meetings and different work streams is really important if we're not to kind of lose what we already have in respect of good practice in the board. And in responding to those performance issues that were raised by the consultant, the quality assurance subgroup is going to do more dip sampling of cases. We're looking for organisations themselves to share their audits more often, and if possible, much more liaison with practitioners to understand the context in which they're working and give us more of a feel of the practice issues that are important to understand through line of sight. And then finally, I mentioned some additional work that the board is undertaking. There's, as well as overlap with MARAC and domestic abuse, there's a real need for us to be clear about how we work with MAPA and the Strategic Management Board in dealing with potentially dangerous offenders who may also themselves have care and support needs. And that was certainly true in the case of the death of a step-grandparent that I mentioned earlier. Inspector exploitation and county lines, a small cohort of people with care and support needs are caught up in county lines, but the impact on them is great nonetheless. So we need to ensure that they receive the level of support that is relevant and proper to their needs. We've already touched on the homeless population and in Dorset we're about to have a learning review looking at, there was a death of a man in temporary accommodation in Weymouth, which is currently going through the court system on a murder charge, and we need to look at what learning can we take from how that arrangement was put in place around risk management and the different needs and risks that different homeless people may have shared when they were brought together in that kind of accommodation, so that can inform our practice going forward. And then finally, before COVID struck, we had committed to join a national project to try and understand the needs of alcohol-dependent drinkers in a safeguarding context better, because there are a lot of issues around capacity for someone who is a dependent drinker that are coming up in safeguarding issues in different places around the country. So it's quite and I wouldn't say it's an ambitious programme of work, but there are a lot of issues that we cannot ignore. And obviously working on them does depend on staff resources, staff being in a position to implement plans and to maintain the good practice and safeguarding that you've seen in our annual report. So we will be flexible and we may have to adapt as the year progresses. Thank you, Chair.
Barry, thank you so much. I'm always in awe of how much information you hold in your brain and how you keep all this together, because it is such an enormous and important board. So thank you for your presentation tonight. I've got Councillor Hazel Allen wishing to speak.
Thank you, Barry. Excellent. Can I just ask what the sort of timeline is with regards to the issues with the dependent drinking? Because there was a recent report from the leaders of general practice in the country that estimated that problem drinking through COVID had gone from 4.8 million to 8.4 million in a couple of months from February to now. And I work in a hospital-based service. I line manage our alcohol liaison service, and we've seen a significant increase in people coming in problem drinking, but also very young people coming in and very, very sick and very, very sad circumstances. I think that this is an issue that we really need to grapple very quickly. So I was just wondering what the sort of timeline that is, and also whether that could be made a strategic priority. Thank you.
Yes, the timeline is for it to be completed in this financial year, because it is run as a national project with, I think, about 20 other boards taking part. And our involvement has been thankfully funded by Public Health. So we are joined up in that respect on that. There has clearly been some delay, inevitably, as a result of COVID in the programme. But I think there are surveys taking place with practitioners at the moment, and we will receive at the end of it some training or kind of webinar on some of the findings, and also there'll be quite a detailed report about the findings as well. So I still think the target is the end of this year, financial year. The timing is not really in our hands. We're one of many who are contributing to it.
I think that's excellent, thank you, and I look forward to seeing that. Thank you.
Thank you.
Thank you. I've got Councillor Diana Butler.
Thank you, Chairman. Yes, I was just looking at the factor of neglect and domestic abuse, and I think COVID-19 has actually highlighted a problem that we've had for a while, but it's just accentuated it. And I think things like depression and isolation and lack of work, lack of activities has really brought it to the fore. And I'm wondering how long we're going to go without more daycare and respite, and also looking into the reasons why people are depressed and self-neglecting, because often people who suffer those sort of things don't admit it, and also if anyone tries to refer them to a service, often it's said that the person themselves has to refer themselves. So I'm wondering how we can get over that hurdle.
Yes, that's a good question, because I think we are expecting to see more instances of neglect, depression, self-neglect emerging as, well, I was going to say as we come out of lockdown, but many places going back into it, of course. I think there will be real pressure on services as a result of this, and we will need to look at more aspects of prevention, and particularly perhaps around bereavement, how people are coped and able to support them through bereavement when they may have lost someone unexpectedly through COVID and the arrangements for their funeral were not as we would have wanted, and they are then alone, very much dealing with their grief and with little support because they cannot be supported. I'm not sure I have an answer for your question, but I think we are realising that the potential for increasing examples of neglect and self-neglect and depression as a result of COVID are very present.
Thank you.
Thank you. Councillor Evans.
Thank you. I've got a few questions. Firstly is just about the data presentation and data analysis. It might just be me, but on page 53 we have a graph of reports to the Safeguarding Board, I think it is, for Bournemouth, Christchurch and Poole. And then the Bournemouth, Christchurch, Poole line is lower than any of the combined lines above. And I just got incredibly confused as to what that was actually showing. So, yeah, just comments on that first, and then I've got a few more questions, if that's okay.
I'm just got to find that, first of all, because that's in the annual report, isn't it?
That's right, yes, I think so.
Claire, can you help at all while I'm looking for this?
I am also looking for it. I'm trying to visualize which graph it is, because it will have been me who put it in there.
Is it the 2-year trend illustrating?
Yes, that's the one.
Water to inquiries, yes. Sorry, your question was why are
you've got the figures for Bournemouth, Christchurch and Poole separate, and then BCP as another line, which is lower than, it's not the sum of its parts, if you see what I mean.
Okay.
I think it should be, because BCP is the light blue line at the top. And then the 3 constituental kind of councils are below that, or previous councils are below that. So I'm hoping it will add up.
I think it's how the colours have come across on my monitor. I do apologise. I think I've mistaken Christchurch for BCP.
Top line is the BCP line, and it only begins April 19. So that should aggregate up the data that you're looking at.
Thank you. Yeah. Right, so that was just the graph. SWAST in their report have mentioned a 50% increase in referrals, which is quite scary. Most of them haven't ended up as Section 42 inquiries, but they've just highlighted a lack of care packages. I wondered if perhaps one of the adult social care directors may want to just comment on that, please.
Do we have David Vitti?
Bear with me, please, Chair. Just wrestling with my, there we are, video camera. Yes, it's, concerns are raised in greater number than Section 42 inquiries, most often because they don't all need to progress to a full Section 42 inquiry. It's not always the case that there's a lack of care being provided. More often, actually, that the solution to a concern can be met through the provision of some form of care management, social work or occupational therapy response. And in fact, what we find is that the better the quality of our triage when we receive and look into concerns, the fewer cases actually go on to a full Section 42 inquiry, because proactive early action and intervention can prevent an unnecessarily intrusive Section 42 inquiry. So it's not necessarily a good thing that a concern progresses to a Section 42 inquiry if in fact it's not needed.
But there are concerns raised about a lack of care. That's what the document states.
There can be concerns raised about a lack of care from care providers, and we see this in care homes in particular, but also with domiciliary care agencies. And sometimes those concerns are perfectly valid and will need a full Section 42 inquiry, but not always.
Great, thank you very much. The National Probation Service mentioned adults may have dual roles as both perpetrator and victim, and I was just wondering how well these individuals are supported.
We don't, yes. Speaking as someone who was involved in the probation service many years, there is only a limited amount of let's say support or intervention with domestic abuse perpetrators, and that has been an issue for many years. For those who have care and support needs as well, who are involved in domestic abuse, to be quite truthful, I don't know the answer to your question. I'd have to look at that and inquire further with the MPS. In my experience, some of the group work programs that have been run for perpetrators are not really geared to people with, for example, a learning disability or some other mental health need. They're focused much more on people who can be managed within a group setting and engage with some of the exercises. So I'm happy to take that question away and try and find out a little bit more about what developments there have been in National Probation Service and also some of the other programs that are being run through community safety partnerships.
Thank you. Sorry, I don't want to take too much more time, but that does lead us quite well into the Harry feedback learning event. They often obviously highlighted a need for better adult children safeguarding boards working together, especially for those people with adverse childhood experiences. But my last comment on that was there were lots of questions raised on the final page of the report on page 89 by the panel, and I just wondered if those had actually been answered in some way.
No, I don't think they've all been answered, to be truthful, because they were raised. There were so many raised, and I think we're really trying to distill what are the real kind of core issues we can take forward from a very complex set of issues that were raised through these three individuals who came together in a rather toxic relationship, really. And the format of the event and the way it was run focused on each of the needs of each of the three, not just the needs of Harry. And they all had such diverse needs. That's why so many different issues were raised, and particularly perhaps about the man called John, who never really found his way into services because he didn't reach the thresholds, but he was clearly very needy and also more dangerous than people thought. And I think we're still grappling with some of the difficulties around that. And I think those people in that position, he actually would have been eligible to be considered by MAPA, but at the time nobody realised that. So this is another reason why we need to really work hard on enabling our different systems that work with people, MAPA, MARAC, MARMS and safeguarding, to be better integrated, and for people to know more about the systems they don't personally work in, so that they understand when they can get the resources from them in order to support someone that they're working with. Does that make sense?
Yes, I just thought the questions were so insightful. Perhaps at some point in future it would be possible to maybe get the answers to them, because they just covered so many different angles and sort of cross-party interactions. Would that be something that could happen?
We will come back to that. Claire, can I ask you to take that? Because we have been working on some of the issues, but not all the ones that were raised.
Yes, so my colleague Glynis Greenslade and I are following up on the actions from the learning event, and we're also looking at how future events might be run virtually and how we can build on the learning, because as Barry said earlier, that event was very well attended. We had 2 sessions that were a real cross-section of people from, it was actually Pan Dorset, and you know, the momentum that we got built up on that day, we do want to maintain that and follow on with it.
Absolutely, which is why I think it's just so important that literally every little bit of learning that can be taken away is properly utilised.
And some of those issues will be feeding into planning at the moment. So the information from some of that will be fed into the domestic abuse strategy group, which is developing the new local domestic abuse strategy. As I said earlier, we were able to share with providers who are obviously very important in respect of this particular case, these issues about, well, how do you help someone maintain a healthy relationship, or how do you stop someone getting into one? So some threads of learning from that have been taken into different settings, but we haven't done a comprehensive kind of answer to every question, I'm afraid. Not have the resources to do that yet.
Thank you, that's everything from me.
Thank you, Councillor Evans. Councillor Dedman.
Yes, thank you, Chairman. Yes, I wouldn't normally interrupt, but, well, not interrupt. On the question that LJ was talking about, it's mentioned on page 65 of Barry's really good report that there was a provider event, and a lot of those questions were actually talked about with the providers, and it was really interesting to hear the insights on how people that actually work in the environment do cope with that. And can I also say, Chairman, that because I mentioned in Barry's report very kindly as being at the meetings, I'm really glad to support this because I think it's a really good report, and as I said in my notes, they're doing a lot of good work now. And can I also say, I'm sorry, Chairman, I will shut up in a minute, that it's really, it's good. I was a provider and I do have the insight, as Barry mentions, but it's really nice that the committee has got so many people with such insight and so many people from the health community. So I think that, you know, we're doing very well. So, but I really would like to thank Barry because I think he's doing a great job pulling it all together. It's no mean feat.
Thank you, Councillor Dedman. Do we have any other members of the committee wishing to ask a question or to make a comment? I'll just give you a minute or so. No. Nope, I can't see any. Barry, it just remains for me to thank you and Claire. Oh, Hazel. Sorry, Councillor Allen, would you like to ask a question?
Sorry, a bit slow there, Karen. I just wanted to thank Barry and just to say that I feel that going forward with everything that's going to impact people with COVID, that safeguarding is going to be a really high priority that we need to revisit and look at and scrutinise. So thank you very much.
Thank you.
Thank you. So the recommendations, members, we are asked to note and comment on the content of the attached report of the Bournemouth, Christchurch and Poole Safeguarding Adults Board. And we're also reminded that the annual report was considered at the July board meeting and final amendments were made. And the business plan will be published on the board website alongside the annual report following the final approval of the business plan at the September meeting. And I think that's happened, doesn't it, Barry?
Yes, it was approved last week, Chair.
It was approved last week, yes. So I think we'll find that the version on our website is still the draft version on the BCP website, but the final version will be on the SAB website.
Yes, it will.
Shortly, if not already. Yeah. So yeah. Thank you, members. And let's move on to item 9. So item 9 is the adult social care charging policy, and I'd like to welcome David Vitti, Pete Courage and Chloe Durrant to introduce this item, and also like to, once the item has been introduced, I'd like to invite Councillor Northover to comment and share with us the recommendations from the working group. And as ever, members, once you have heard the presentations, please put RTS on the left-hand panel. Thank you. So David, Pete and Chloe.
Thank you, Chair. If I can perhaps just introduce this. This committee, of course, had the charging policy first brought to its attention in November 2019, when we set out the general principles of a proposed policy and sought endorsement from this committee to proceed to a public consultation, which has now taken place. The reason we brought this forward was because we have 3 legacy charging policies for adult social care, which mean that until that's changed and we have a single charging policy, local residents across Bournemouth, Poole and Christchurch are being charged different amounts for the same care, which we would argue is an unsustainable position. As well as the issue of equity for all local residents, the key underpinning policy, or rather the key underpinning principle of the policy, is that of full cost recovery. Now, this is something that all of the 3 legacy policies contain as a central feature, and is essentially the principle that where somebody is assessed as being able to afford to pay the full cost of their care, and actually that's only about 4% of our clients, then they should pay the cost that the council itself pays to purchase that care. And we'll hear, I think, from Chloe that underpinning principle was broadly supported during the public consultation. So in a moment, if I may, Chair, I'll turn to Peter Courage, who can just describe some of the principles of the proposed charging policy, and then Chloe Durrant will run through the outcome of the public consultation, the findings, and then finally, and perhaps after Councillor Northover has shared the findings of the working party, Pete can talk a little bit about how we would apply the learning from that public consultation into any proposed implementation of the policy. So perhaps I could turn to Pete to briefly talk about the content of the proposed policy.
Thank you, David. Good evening, everyone. So, as David says, broadly, the aim of the policy is to create a single document which governs adult social care charging across BCP Council. And in doing so, this replaces the inherited 3 legacy policies. Much of what can and can't be charged for is mandated in government legislation, primarily the Care Act, and so the broad framework of all 3 legacy policies was the same. Where there were differences, this new policy aims to reconcile those, and these new proposals were the focus of the public consultation earlier this year. The draft policy itself begins by setting out a set of core principles, which I believe are the most important elements of the policy. And in those set of principles, the key factors of fairness and equity are clearly evident throughout. Then perhaps the most important principle, which sets this policy apart from its predecessors, is that of ensuring that the charge is based on the actual cost of the service to BCP Council. Of course, individuals will only contribute what they can afford following a financial assessment towards that charge. But this principle that the maximum charge is based on the cost of service is what establishes common ground where before there were some differences in the charges that were applied. The policy then goes on to outline when and how charges will be applied before covering in detail the financial assessment process. This does get quite technical, but it's a really important part of the policy, as it's these financial assessments which will determine how much an individual is able to contribute towards the cost of their care. The policy then finishes with a list of roles and responsibilities for council officers and also for the individuals being charged. And it's here you'll see the responsibility for annual reviews of charges so that we can ensure that they continue to reflect the cost of services, and also the ability for our director, David, to waive charges in exceptional circumstances, which is one of the proposed mitigations which I can discuss later on. So that's roughly the 30-odd page policy in a nutshell. Chloe is now going to take us through the consultation, the results of which actually informed the policy draft that you see today.
Thanks, Pete. Let me just share my screen so you can see the presentation. Okay, are you able to see that? Yeah, okay. I'll skip past the background because that's been covered by David and Pete. In terms of the consultation itself, a questionnaire was prepared alongside background information and a summary about the proposed changes. The consultation materials were sent to all those in receipt of chargeable non-residential services, which was just over 3,000 people, inviting them to have their say. Anyone identified as having a learning disability was sent easy read versions of the document and the questionnaire. We had a dedicated helpline available to help people who requested the document and questionnaire in another language or format. The consultation ran for 8 weeks from the 20th of January to the 16th of March this year. There were drop-in events at each of the day centres and at libraries across Bournemouth, Christchurch and Poole Council, which provided an opportunity for people to ask adult social care staff questions about the proposals. In addition to that, DOTS Disability were commissioned to undertake a qualitative discussion group in relation to the proposed changes. And the consultation was also available online and open to all residents in Bournemouth, Christchurch and Poole, as well as to organisations and stakeholders. The online survey was promoted via the Council's social media channels and newsletters at the planned drop-in sessions and publicised on the Council's consultation tracker. And the total number of responses to the consultation was 536. So in terms of the results, the first proposal was to introduce one maximum charge for attending a day centre. Just over half of respondents agreed with that proposed change, and less than 1/5 disagreed. The rest of the respondents, 28%, didn't have a view either way. You'll see as I go through the presentation that in the main, respondents who completed easy read versions of the survey generally had higher levels of strongly agreeing, but the overall agreement level wasn't significantly higher than other groups. Respondents were then asked what impact that proposal to have one maximum charge for attending a day centre would have on them. Almost 3 in 10 respondents said they'd be impacted a lot by the proposed change. Just over 1/4 said they'd be impacted a little, and almost half said they wouldn't be impacted at all. They were then asked to comment about how it could have an impact on them and also any other suggestions. The main theme to arise from the comments was the financial impact of the proposal. Some respondents said they might have to stop attending the day centre if this proposal was to be introduced, or decrease the number of times they attend, and also some they've mentioned to the fact that the associated impact that would have on their well-being and possibly that of their carers as well. When they were asked if they had any other suggestions, the main theme was that the cost could be calculated using an average of the 3 current charges from the preceding councils. And the other main theme was general agreement with the proposal. The proposal to introduce one maximum rate for transport had similar levels of agreement. Half of respondents agreed with the proposed change to transport charges, and just over 1/5 disagreed. And again, there was around 28% that didn't have a view either way. The impact of the one rate for transport, 1/4 of respondents said they'd be impacted a lot by that proposed change, and the same proportion again said they'd be impacted a little. Half of respondents said they wouldn't be impacted at all. In terms of comments on this proposal, again, the main theme to arrive was the financial impact. Some respondents again saying it might stop them attending the day centre, or it could decrease the number of times they attend if the cost of transport is too high. In terms of other comments or suggestions, the main theme was about how the cost could be calculated, and some suggesting it should be based on mileage rather than a fixed amount no matter how far you're travelling. It should be done depending on how far you have to travel, very similar to how taxi charges work. The next question people were asked about was whether transport should be part of an all-inclusive charge. So regardless of whether they use it or not, that charge would be incorporated in the cost for the day centre. This had lower levels of agreement. 1/3 of respondents agreed that it should be part of an inclusive charge, and over 2/5 of respondents disagreed. In terms of impact, 3 in 10 respondents overall said they would be impacted a lot by an all-inclusive transport charge. Just over 1/5 said they'd be impacted a little, and half of respondents said they wouldn't be impacted at all. We also asked what sort of impact they thought it would have on the environment as well as the impact on themselves. Just over 1/5 of respondents thought it would impact on the environment a lot. 37% thought it would have little impact, and over 2/5 thought it wouldn't impact on the environment at all. The comments in relation to having an all-inclusive transport charge were quite interesting. The main theme to arise was that respondents felt it was unfair to have to pay for something they might not necessarily use, and some respondents also raised the issue of choice, that it was wrong to take that choice away if they already either choose to walk or they get a lift from a family member or friend. It seemed unfair, and it was mixed feelings around the environmental impact as well. For that reason, some felt that if they already walk, that it didn't make sense to then be encouraged to actually use transport, or if they get a lift from somebody that's potentially already on their way to someone else, that made more sense than a separate piece of transport. Again, they were asked whether they had any other comments or suggestions in relation to this proposal, and that was mainly a repetition that they felt it was unfair to pay for something they don't use, and just general disagreement with the idea of including transport costs with day centre costs. The next proposal was in relation to having one rate for bathing, assistance with bathing. Just under half of respondents agreed with the proposal to have one rate for bathing, and under 1/5 of respondents disagreed. There were quite a large proportion, just over a third, who didn't have an opinion either way. And the impact on this was a lot lower. Less than 1 in 10 respondents said they'd be impacted a lot by this proposed change. 13% said they'd be impacted a little, and almost 4/5 said they wouldn't be impacted at all. In relation to the comments about how it would impact them, they were fairly mixed. Some respondents said there would be little or no impact, while the respondents felt the cost was too high. When asked about other suggestions they'd like to make, the main theme were various alternate suggestions. Some included that maybe bathing should be part of the care that's already received at a day centre, so it shouldn't be an additional cost. It should be included in the costs they already pay for attending the day centre. And again, there was suggestion that it should be the average of the previous 3 rates. And then there were 3 proposals in relation to deferred payment agreements. So the first was about 1 rate for the setup of those agreements. Just under 2/5 of respondents agreed with the proposal to have 1 rate for setup, and just under 1/4 disagreed. 38% were neutral. The next, and then in terms of impact of having 1 rate for the setup fee, 1/5 of respondents said they'd be impacted a lot by that, 22% impacted a little, and almost 3/5 said they wouldn't be impacted at all. The next one in relation to deferred payment agreements was 1 rate for the annual fee of that agreement. Just under 2/5 of respondents agreed with that proposal, and 1/4 disagreed. And again, a fairly significant number, 37%, neither agreeing or disagreeing. And the impact for that is similar. 1/5 of respondents saying they'd be impacted a lot by that proposed change, almost 1/4 impacted a little, and over half of respondents, 56%, saying they wouldn't be impacted at all. And finally, with deferred payment agreements, that was the proposal to introduce 1 rate for ending the agreement. For this proposal, just under 1/3 of respondents agreed with that proposal, and the same amount again disagreed, and 36% being neutral. The impact of the proposal to have 1 rate for ending the agreement, just under 1/4 of respondents saying they'd be impacted a lot by that proposed change, 1/5 saying they'd be impacted a little, and almost 3/5 saying they wouldn't be impacted at all. Respondents, as with the other proposals, were asked how it would impact them, and the main theme to arise from those comments was the financial impact of the proposals, and another prominent theme was general disagreement. In terms of other suggestions or comments, the main theme was that the rates were too high. After asking people their views on the proposals, they were asked that if these were to be introduced, what support they'd like to receive. Over half of respondents would prefer face-to-face contact, and over 2/5 would prefer an information pack. Just under 1/5 would like support through their existing client and carer groups, and just over 1 in 10 would like online support. There was also less than 1 in 10 preferring a telephone hotline, and 6% liking support through services such as the Citizens Advice Bureau. Then we undertook a qualities analysis on the results. So this is looking at whether there's any statistically significant differences between different groups in relation to the impact the proposals might have on them. So in terms of introducing one charge for attending a day centre, respondents with a disability were significantly more likely to be impacted, either a lot or a little, compared to those without a disability. And Christian respondents were significantly more likely to be impacted, a lot or a little, than those with no religion. For introducing one charge for transport, again, respondents with a disability were significantly more likely to be impacted, a lot or a little, compared to those without a disability. And mainly the rest, there weren't any significant differences of notes, aside from introducing one rate for a set-up fee for deferred payment agreements, and for that one, female respondents were significantly more likely to feel they'd be impacted a lot by that compared to male respondents. We also looked at the results by area. So this is a summary, just breaking the results down by whether respondents lived in Bournemouth, Christchurch or Poole. As you can see in the main, agreement levels are lower for respondents in Christchurch compared to those in Bournemouth and Poole, and impact levels higher for the majority of those. This is to be expected because it was Christchurch residents that there was more of a difference in the proposed charges compared to what they're paying at the moment compared to Bournemouth and Poole residents, because the charge now reflecting the actual cost of the service. And then finally, I'll just move on to, I don't know, Pete, if you'd like to cover the what happened at the Dots Disability Focus Group, please. Thank you.
Absolutely. Thank you, Chloe. Back in March, I had the really valuable opportunity to attend a focus group, which was arranged by Dots Disability. This allowed for some really interesting and lively discussion around each point of the consultation. The individuals around the table had attended or interacted with a number of services, both in the past and presently. It was interesting. The group was really honest and open, and I felt it added a lot to the overall feedback that we eventually received. You'll have seen the full report, but essentially there were 4 broad recommendations from the group. Chloe, could you just pop onto the next slide for me, please? So you will see the first recommendation was encouraging, and that everyone around the table agreed that charges needed to be harmonised. There was, however, concern that in each case the harmonisation was occurring at the most expensive charge from the legacy authorities. But the members of the focus group understood that this was due to those charges being the most reflective of current service costs generally, because they were most recently reviewed. There were then 2 recommendations about Tricura, who, as you know, are a significant provider of services for the council, around ensuring best value and quality of services into the future, which is a big part of the work of my colleagues in the commissioning unit. And finally, a recommendation that these changes be considered in the context of everything else that is going on. And this was, of course, pre-COVID, so that adds another element to this, I think. This final point is a key one, which prompted us to propose and discuss a number of mitigations to lessen the potential impact of the transition to these new charges for individuals and indeed the entire cohort. These mitigations were discussed at the member working group, and if it's okay with the chair, now might be an appropriate moment to hand over to Councillor Northover, who's provided a report on those sessions.
Yes, thank you, Councillor Northover, if you can present the report.
Okay, so you can read the report, it's in the appendix, but mainly I'll go through some of the way that we ran the meeting. So we had 3 meetings altogether with the help of officers, and we had 4 members of this committee that were part of those meetings. At the first meeting, we started off by agreeing the principles that that the officers could go away and start to develop the proposals for the report. And then at the second meeting, we looked at those proposals, and we also could ask questions and drill down a bit, and we could think about how we were going to do the consultation, and we had proposals about how we would consult and the questions that we were going to ask. But we were at that point able to shape some of that as well and make sure that certain questions were looked at and some of the wording was changed. So then when we came back after quite a long time because of COVID, we quite recently had our 3rd meeting, and that's where we could see all of the feedback from all of the consultation that everybody has just been seeing just now. So we've got our recommendations are that we endorse the proposals for the charging policy. Particularly, we picked out that transport and day centre attendance charges are going to be separate because this is what came out of the consultation. One of the principles was that if people are paying the full charge, for the full charge, that we should charge them the full cost to the council. We looked at, as we were just talking about then, the mitigation. We decided that we will make sure that we give the earliest notice we can to people using the services, that we'll have a telephone helpline so people can get help if they are concerned, and that we would have a process where if in certain circumstances there could be waivers or write-offs in some exceptional circumstances. We also agreed that there would be an annual review by officers. So this isn't something that if it turns out we find there's a unexpected outcome, that we won't be revisiting it. Will be looked at by officers each year. I don't think I've got anything else to add on that, unless there's any questions. Thank you.
Thank you, Councillor Northover. It's not a question. It's just I'm curious. I'm trying to think back to the last meeting that we had, which I think was in August. So you chaired the working party, and the recommendation says endorse proposals for the BCP adult social care charging policy. I do seem to remember that a couple of people abstained when we put that to the vote, and I seem to remember that I was one of them, and there were another couple of councillors. But if I'm getting confused with another meeting, then do correct me. But I do personally recall that I abstained on that decision.
Now you're saying that, I think I do recall that as well. So, but I don't know what do we do about that?
Okay, I'm just commenting that it's not strictly accurate to say that the working party endorsed the proposals for the charging policy.
Well, I do agree. I do remember you, and I think somebody else did. Now you said that, I agree. So what do we just? How do we make that right?
Perhaps the officers could help us here.
Chair, hi, it's Joe Tyler. Oh, sorry, David.
No, please go ahead, Joe.
I was just going to say obviously the recommendations within the report are that the committee consider the policy as has been put forward, and obviously a main part of that is to take into account what the working party, the work that they have conducted, the findings that they have made, and it was for the working party to obviously put forward any suggestions or recommendations that they had. So this is the chance for the working party to obviously voice those concerns, and if they felt they wanted to endorse the proposals, if the majority of the working party did, then that is, as I say, what should be put forward.
Councillor Evans has said the majority of the working group agreed. I think there were 5 of us, Councillor Northover, working party, and I've got a feeling that 3 of us abstained, but I think one of them may have been Councillor Matthews. I don't want to put you on the spot, Councillor Matthews, but would you like to comment?
Sorry, Chair. Yes, I seem to remember abstaining, if I'm honest, but I can't recall the meeting in too much detail. But I've got a feeling I might have abstained.
I think just for accuracy, then we should actually perhaps change that first line to the actual number of votes for, against, and abstentions. There were no against, but there were fors and abstentions. Is that something that we can that we can alter, Joe?
So that is something that can be taken into consideration by this committee before you take a formal vote on it. As I say, it is for the entire committee to agree an action going forward, but I think clarifying the sort of informal vote taken at the working party of, I believe Councillor L.J. Evans has just clarified it was 2 for and 3 abstentions. That is something for this committee to consider when the formal vote is put forward. So I don't know if any more discussion is wanted to be had on that, or questions through you, Chair, but in terms of moving forward with a vote, it's for the committee to consider that when the formal vote is held.
I think that's really helpful, Joe. Thank you. It has to be accurate, obviously. I've got Councillor Jackie Edwards.
Sorry, my internet dropped out for the last few minutes, so I'm not sure what you were discussing there on the vote. It was just something else that I wanted to ask about. It had on policy 23 where it's mentioned that the actual cost to BCP. Now, can I ask, is this split between what goes to, for example, the day centre and what goes to admin for BCP, or does it all go to the day centre? Because if it doesn't all go to the day centre, could that make them unviable, especially at the moment with their restriction on numbers?
Is someone picking up that question?
Can I respond to that, please, Chair?
Thank you.
The cost to BCP Council for somebody attending a day centre is in fact derived entirely from the Tricuro contract cost, if it's a Tricuro day centre, or the price paid by BCP Council to an independent day centre. So in answer to your question, the full charge goes to the day centre. There's no allowance for administration or any additional on costs.
Oh, okay, thank you. It was just that I'd heard something different from an outdoor day centre, but perhaps I can talk to you about that at another time, David.
I'd be very happy to respond to that outside of this committee, but just to reiterate, the charge that we make to our fully paying service users is 100% reflection of the cost to the council that we pay to Tricuro or an independent sector day provider.
Okay, thank you.
Thank you. Councillor Butler.
Thank you, Chair. Yeah, I'd just like to comment because I was actually one of the people acting as one of the public who actually completed a questionnaire, and I found it quite difficult in some questions about the impact, because obviously not having a disability or whatever, so I've got to attend a day centre, it wouldn't impact me personally, but it might impact a resident or a friend, somebody I know. So that might have skewed the numbers on the people answering about impact. And the other thing is, I find it hard to believe that the service is so expensive to have people given a service for £35 for half a day, plus the charge of a bath if you need it, when everybody is in one place. It's not like somebody going from door to door on home care. So, I mean, I'm wondering, is there anyone else who can provide the service other than Tricura?
Chair, would you like me to respond about the can anyone else provide the service?
Yes. Thank you. I thought David had forgotten he was on mute.
No, well, there's two things. There's two different things here. So in terms of the cost of the service and the additional cost of bathing, so it's additional staff that come in to do the bathing. It's not Tricura staff. The day centres are the places, the Tricura-run day centres are the places that have the bathing facilities. So they have the specialist baths, which people can't, if they can't access their own facilities, unlikely to be provided by other providers. And of course, if we chose as an organisation to tender out the services, we could, and that could be a different provider than Tricura. However, all of the staff would be over, and those staff costs, as they are now, and their wages and other terms and conditions would transfer to any new provider. And as the majority of service costs are in the staffing, then it's unlikely that we would get a better or, if you like, a cheaper service. So it's quite a complicated area to think about. There are no guarantees about any provider being the only provider that can provide a service. Part of this is around the buildings that we operate these services from. I hope that answers the question.
Can I add something else as well?
Of course, please go ahead.
Thank you. Yes, a lot of people said that they would prefer an average between the costs of the legacy authorities, which I think is quite a sensible thing to do. So I can understand that fully, and that doesn't seem to have been taken on board somehow. I don't know whether that could be looked at again, the actual cost, because a lot of people know we've got to harmonise the cost, but it's actually how much you pay.
Could I answer that, please, Chair?
Sorry, thank you, David. I was on mute.
I think it's fair to say that the charges in Christchurch are artificially low. They're historically low charges that have been levied by Dorset County Council prior to LGR. And in fact, Dorset Council has reviewed its own charging policy and raised the charges. So had Christchurch not become part of BCP Council, the residents in Christchurch would have experienced an uplift in charges anyway as part of Dorset Council's uplift. The charges in Bournemouth and Poole are very similar. And indeed Christchurch would have been very similar had it been uplifted in line with Dorset's charges. So I think the first thing I would say is we chose not to use an average because it would be using a falsely low charge in Christchurch. But the other reason that we haven't proposed using an average is because that would actually, for full charge payers, set the charge below the cost to the council of providing the service, and therefore they would be subsidised services, and that would be that would be unusual nationally, and it would place us out of step with the legacy policies which focused on full cost recovery, and that's what we're proposing in this new charging policy rather than a subsidised approach. Chair, I think you're on mute.
Sorry. David, you had an RTS. Was it about your comment that you've typed into the conversation bar? Or was it something different?
It was simply a request, Chair, to answer the question before last.
Thank you. So I've got Councillor Hazel Allen. So, sorry, Councillor Butler, had you finished with your question?
Yes, thank you.
Thank you. Councillor Allen.
I was just a bit concerned to hear that some members of the working group did feel that they had to abstain on the vote, and I was just wondering if we could have the details about why they felt the need to abstain, because obviously this is an important piece of work. Thank you.
Thank you, Councillor Allen. I'm trying to think, I'm trying to cast my mind back. I think the concerns which personally I expressed at the working party was the impact or the potential impact on what is a relatively small number of people, about 20 people in Christchurch and 20 to 30 people in Poole. In Poole, they currently have the transport charges included. So it's an extra, if they have transport both ways, that is an extra, well, it's £21 less the difference. They pay £39 at the moment, and that would obviously go down to 35. So it's that difference. It's if somebody went a couple of times a week, that seems quite a significant amount, and it's quite a significant amount for people in Christchurch as well, and quite a step up from what they'd be paying. I absolutely get the point that it's people who can afford to pay the full charges. I get that point. But I was really quite concerned about the step up, that somebody may be able to pay the charge in full, but does that mean that they are sacrificing something else that they like to do in order to go to a day centre? Might it mean that they don't attend the day centre and therefore they're going to be socially isolated? And there's also an impact, of course, on their carer if they have a carer at home. So those were my concerns, and I'll leave it to others who abstained to articulate their concerns, should they wish to.
Chair, can I just, sorry, it's Councillor Chris Matthews here.
Yes.
Yeah, I'd say my views were quite, if I recall, similar to yours at that sort of at the time. So it felt a bit of a jump. So I just felt a little bit uncomfortable with that, and that was my reasons for abstaining on that particular occasion.
Thank you. Councillor Northover, did you wish to make a comment?
No, I don't have any other comment. Thank you.
Thank you.
Sorry, could I come back, Chair?
Yes, of course.
So obviously we have to make sure that we're not subsidising services if someone is considered to be able to pay, but equally could we not look at maybe either a phased increase, or if it is such a small number of people, we're not talking about hundreds, we're talking about tens, is there no way that we could actually make sure that we review those people again and make sure that we're not negatively impacting them by quite a big jump up in charges, and whether or not we're not going to be negatively impacting them and their finances and their, you don't want them to not attend just purely because that feels like a very big chunk of their weekly budget. Thank you.
Thank you, Councillor Allen. David Vitti.
Thank you, Chair. Just to respond to that last and very helpful comment, I think as officers we would be very happy to institute a review programme or impact analysis to understand the impact on full charge payers. And I'd also comment that the policy allows for the charge to be waived either in full or in part in exceptional circumstances. And I think if there were instances where people felt they couldn't afford to attend and, as Councillor Rampton has said, maybe became socially isolated as a result, then we would in those cases, I think, consider that to be exceptional and may wish to look for a full or partial waiver in those cases. So very happy to do a review, and there would be a way that we could respond to anybody we felt was having difficulties as a result of the additional charge.
That's excellent, thank you.
Are you happy with that response, Councillor Allen?
Yes, I'm just happy that it's being considered, because I think we need to, we need to consider that actually this could be an impact to somebody, and just because we've got 3 councils coming together, individuals shouldn't feel too negatively impacted by it. Thank you.
Thank you. I don't know if any other members of the committee have any comments to make. I wonder if our portfolio holder, Councillor Dedman, might like to comment. Obviously, Councillor, you're a councillor in Christchurch, and some people in Christchurch are affected, and this will be going to Cabinet. So, did you have any comments that you'd like to make on the policy?
Yes, thank you, Chairman. Well, I've listened to all the comments from the Working Party, which seem quite mixed, to be honest. I can comment very clearly on the Christchurch situation, and I think, as the officer said, and as has been brought out in the report, the costs from Dorset County Council, of which I was a member, were, for some reason, kept artificially low. Now, whether that at the time was a policy, I really think it was not a policy so much as an omission. But whatever it was, the prices are low, so it skews the whole area of charging. I absolutely understand that the committee and the Working Party don't want to up the costs tremendously quickly. And I did feel when the report was presented to me, and I have felt all along, that there are mitigations all through the report. Oh, sorry, Chairman, I'm pointing at the screen and you're not. But there were mitigations throughout the report, and I totally agree with the Working Party that these must be brought into play. And I think David Vitti has said as well that anybody who can't pay will not be asked to pay the full cost. And as we heard, the full cost is indeed a very basic cost. The other thing is that I would also comment to the Working Party and to the committee as a whole, not to forget that we are now going into an area where we are going to be paying all our carers and our staff a living wage. And that, again, will impact on everybody. So I think there's a huge amount to consider on this report. And while I've been listening, as I say, very, very closely, I think your comments have been really, really helpful. But certainly, as the Christchurch thing, I can confirm that the charges were kept artificially low. As I say, whether that was by whether it was meant like that or whether it was just simply that somebody didn't put them up one year. And I really can't comment on Poole. I'm sure perhaps one of the other councillors could. But as I say, I was content that there will be mitigation for all this. Thanks, Chairman. Was that an answer to what you asked me?
Thank you, Councillor Dedman. Are there any other comments from officers at this stage, or are you happy for me to start summing up? And we're going to go to a vote on this one because it's to go on to Cabinet. I'm not sure if Chloe was first and then David.
Yes, thank you, Chair. I just wanted to comment on a previous question about the impact question on the survey. So it asks people how it will impact them or their family, but we also ask in what capacity people are responding to the questionnaire, so we can split the results out to show the impact on service users themselves as opposed to other people. That is all within the full report, and it was on some of the charts, but for the purposes of the presentation and time, I just covered the overall responses. But yeah, it shows the impact for service users themselves as opposed to overall. And then that's also why we have an additional comments box to ask people to expand on how it will impact them so we can get a better understanding of that. Thank you.
Thank you, Chloe. David?
Thank you, Chair. My request was a request to answer Councillor Allen's question, which indeed I've done, so thank you.
Thank you very much. So just to sum up, the Working Party have made their recommendations. Despite the fact that I abstained at the Working Party, and that I do still have concerns about the quite large increase for some individuals, I am reassured by the mitigation that's been put in place. I think having the annual review is really important. I think the ability for the director to waive any charges or reduce any charges is important. I think the support that's going to be offered to people and the information and the sort of the timing of it, so people won't just be landed with a bill, they will get some warning, has gone a long way to reassure me that it will be handled sensitively. I know you as officers, and I know that you will handle it sensitively. There's a principle here, isn't there? There's a principle of fairness, and that principle is the right one, that people across the conurbation should be paying the same. So I am going to propose that we recommend to Cabinet that this charging policy is approved, and I'm seeking a seconder. Councillor Evans, happy to second, thank you. Before that, I think I've got Councillor Allen and then Councillor Northover.
Sorry, I know you're about to move to a vote. Could I just have it confirmed that you were talking about the information that would be made available? Is it clear in that information that if people do feel that this is going to negatively impact them and cause them anxiety, that they know exactly how to seek advice and support with regards to that within the information that they're given? Thank you.
David, are you taking that one?
I'm very happy to, Chair, although I note that Peter Courage is typing, and so he may have been ahead of me on this.
Peter?
Yep, happy to step in. Yes, thank you for that question. Just to know that part of the mitigations that we will be putting in place is a dedicated helpline, so that individuals can be given appropriate information and advice, and obviously we'll make sure that that's available in all the various formats that are required. I should also point out that the planned comms communications in terms of implementation, there would be general communications to allow people to understand that this is happening, but there would then also be targeted communications to individuals to tell them if they will be affected. So there will be a long lead-in time to this, and there will be ways in which we can make it really clear to individuals where to come for further information and advice.
Thanks, Pete. Joe, you've indicated to speak. Is it about the process of taking a vote?
Thank you, Chair. Sorry, just turning my video on. It was just to clarify whether in the move you wanted to clarify that contained committee support of the use of the mitigation measures, as well as approving or endorsing the entire policy for Cabinet's consideration in November.
Yes, so it will be, shall we take A, B and C together? Are committee members happy to do it en bloc? No, Councillor Butler. Councillor Butler, what would you'd rather take the items separately?
Yes.
Thank you. That's what we will do. Councillor Edwards, do you feel that I think you dropped out at one point. Do you feel that you heard enough of the debate to be able to take part in the vote?
Yes, that's fine. I was part of the Working Party anyway, so that's fine.
Thank you. I think I've missed something. Councillor Northover, did you do an RTS?
It was only because I was going to say I would second it, but Councillor Evans got there before me, so.
Oh, right. Okay, thank you very much. Okay, Joe, so we've got a proposer, we've got a seconder, and do you now take over this part of the vote?
Firstly, I just wanted to state that during the course of the meeting, Councillor Mark Robson has actually sent in his apologies, so there will only be 10 committee members voting. I can certainly conduct a roll call, during which time I will read out members' names individually, and at which point, when you hear your name, please can you confirm whether you are voting for, against, or abstaining from the motion. So, Chair, if you're happy, I will now conduct that vote.
And you're going to take those items separately, Joe?
Yes, certainly. So I can go through. Chair, did you want recommendation A to go to a formal vote, purely because it's just for the committee to note and comment?
You're absolutely right, and we don't need to vote on that one.
Certainly. So, members, this is recommendation B that's been moved and seconded for committee to recommend to Cabinet that the new adult social care charging policy is approved. I will conduct the roll call vote now. Chair, I'll start with you. So, Councillor Rampton?
For.
Councillor L.J. Evans?
For.
Councillor Hazel Allen?
For.
Councillor Jackie Edwards?
For.
Councillor Nick Geary? Councillor Nick Geary? Okay, Chair, I'll come back at the end. Councillor Cheryl Johnson?
For.
Councillor Chris Matthews?
For.
Councillor Roberto Rocca?
For.
Councillor Diana Butler?
Against.
And Councillor Lisa Northover?
For.
Thank you, Chair. I'm just going to try. Councillor Nick Geary, did you want to place a vote in this? Chair, I can't see any response from Councillor Nick Geary. One last time, Councillor Nick Geary, did you want to vote? Okay, Chair, I'm not sure what's happened there. Are you happy for me to finalise those votes then?
Thank you.
Okay, so the total number of votes for the motion is 8. The total number of votes against is 1, and there were no abstentions, so that motion has carried. Chair, if you're happy, I will now conduct a roll call vote for recommendation C, which is for the committee to support the use of mitigation measures which assist clients when moving to new charging arrangements as set out in paragraphs 17 to 21 of the reports.
Thank you.
So yourself, Chair, Councillor Rampton.
For.
Councillor Evans.
For.
Councillor Hazel Allen.
For.
Councillor Jackie Edwards.
For.
Councillor Nick Geary. Okay. Councillor Cheryl Johnson.
For.
Councillor Chris Matthews.
For.
Councillor Roberto Rocca.
For.
Councillor Diana Butler.
For.
And Councillor Northover.
For.
Have I got the sound back now?
You have indeed, Councillor Geary. Unfortunately, you missed the vote for the first recommendation.
I apologise. I lost the sound.
Okay. Did you want to vote on recommendation C?
For.
Thank you very much. So, Chair, the total number of votes cast for the motion is 10. There were no votes against and no abstentions, so that motion has carried. Thank you very much, Chair.
Thank you, Joe. By the way, Joe, I have lost my second bar, so if you're sending me anything, I won't be able to see it for the moment.
Okay, thank you. I will re-add you.
Thank you. Okay, thank you, members. We're going to move on now to the forward plan, item 10. And I hope everybody has had a chance to look at the forward plan. We had our informal meeting where we had a number of topics.
Councillor Robertson, could I just interject? I apologise.
Sure.
As I still have some concerns with regards to the last item and the mitigating circumstances, could we ask for a report to be brought forward when these charges are changed so that we can scrutinise that and be satisfied that mitigating circumstances have been taken into account? Thank you.
Thank you. I'm sure we'll be keeping a very close eye on this one, and I'm hopeful that David and Pete are happy to do that.
Thank you. Sorry to interrupt.
Councillor Jackie Edwards.
Thank you, Chair. It was mentioned at Health Watch that they were going to do a survey, results of a survey of access to health and care during the COVID. And I wondered if perhaps we could combine this with my ask about reviewing GP surgeries and how they're moving forward, sort of with things like going more to virtual consultations and that, whether it would be sort of would marry up quite nicely the two subjects.
I think that would work quite well. I think Louise put in the bar that the report was coming next month, but I don't think it's on the agenda for the next Health Overview and Scrutiny Committee, is it? So it might be the following meeting?
I don't know. I just thought that when she did that report, it would be good to sort of do it with the GP surgeries.
Yeah. Okay, well let's take that idea forward. The topics that we discussed at the informal meeting have been passed and discussed with the officers, and there are lots of similarities between items that are on the future forward plan, where they might dovetail quite nicely, others don't, and they will have to be separate items. Sorry, members, I'm still trying to find the forward plan. There's such a lot of that social care charging policy. So for the next meeting, we have, I'm getting there in a minute, we have a couple of items on there. Help me, someone. Who's got the forward plan in front of them?
Better Care Fund end of year performance.
I've got it. Thank you, Councillor Edwards. The Better Care Fund end of year performance, quite a big meaty item, and the COVID-19 winter response, and that's absolutely essential that we do keep track of the winter response, as we are expecting some winter pressures on both health and social care. The suggestion I was going to make was to add to that meeting date scrutiny of Tricuro, and I know that's a subject that many people are interested in having a closer look at, because it kind of covers this committee in terms of the care provided by Tricuro, but it also covers the Overview and Scrutiny Board in terms of the financials of Tricuro. My suggestion was going to be that we invite the members of the Overview and Scrutiny Board to attend our committee on the 30th to take part in the item on Tricuro. But I wanted to bring that to committee first and ask what you thought of that. Any comments, please? Sally, you got an RTS. I'm sorry, I missed that earlier. Is that to do with the forward plan?
It is, Chairman, and it was also in reference to the previous ask around general practice response. If it was helpful, we can do a combined response around COVID recovery and winter pressures, as is stated on the forward plan, and bring in the elements around general practice into that. I think we have shared with your corporate office a report around general practice response to COVID, but we can weave that in to the recovery response, and I've already been in contact with our chief officer because it might be helpful that we do a bit of an NHS system contribution to that item on the forward plan.
That's really helpful, Sally, thank you. Councillor Edwards, are you happy with that? Oh, yes,
Yeah,
fine with
that's
me.
right,
Yeah, thank you. Excellent. Okay, any comments? Do I take it that we're all content with having Tricura on the next meeting and inviting members of the ONS board? Any dissent? Please type in the column. None? Okay, that's great. LG Evans, Councillor Evans.
Thank you. Yeah, more than happy with Tricura Scrutiny. And just to mention, could we have Barry perhaps or someone bring back the answers to those questions at a later date, if that could just be on the forward plan so we don't forget about it, please.
Thank you. I'm sure Joe's already minuted that. Councillor Hazel Allen.
I think I've mentioned at a previous meeting that I'm aware that a number of services are being reviewed who are under the umbrella of Tricura, particularly day centre provision. Obviously, it's not unreasonable to reassess provision in the light of COVID and whether or not certain maybe day provisions are effective, cost effective, etc. But I would particularly like scrutiny on that because a bit like the conversation we've just been having, you know, it's the impact on individuals that we really need to make sure is well covered. Thank you.
Thank you, Councillor Allen. Any other comments on the forward plan? Anything that people think should be on there that isn't, is on there that shouldn't be? January is looking pretty thin at the moment, but there are plenty of other topics that we can put it into there, which will dovetail quite nicely. Councillor Allen.
And there's quite a lot of work going around healthcare provision for homeless and people that are temporary housed and etc. There will be a lot of work going on over the winter, so it would be maybe interesting to have a look at that in January or maybe even into the spring, but it would be quite good to scrutinise that. Thank you.
Thank you. Joe, I'm sure you're making notes of these comments and suggestions.
Absolutely, Chair. And as always, you know, the forward plan is an ever-evolving document that will be impacted on things like COVID and time frames for different items. But yeah, noted down all of those suggestions and comments, and we can obviously work with yourself and officers on updating the forward plan. Thank you very much.
Lovely, thank you. Well, we've been going now for 2.5 hours, so we're probably needing to go and have some dinner and a cup of tea or something.
Chair, can I just ask a question?
Yes, of course. Sorry, you did have an AOB, didn't you?
Yeah. I don't know whether any of the officers can answer me this. It's just concerns over the blue badge, either applications or renewals, because I believe there's like a 12-week backlog with this. So if someone's blue badge has run out now, they have to the end of October, but that means there's possibility that they won't have a blue badge for November and December. And I just wondered if they knew how well they were doing on catching up with the backlog, or, you know, and especially for people that have got new applications in, because this is a vital means of them sort of getting out and about. And if they can't use a blue badge, it makes it difficult for them. Thank you.
David, are you in a position to answer that question, or do you want to do a written response to Councillor Edwards and the committee?
Thank you, Chair. No, I'm not in a position to answer that. The blue badges are administered by our corporate contact centre and not adult social care. However, I'm very happy to talk to colleagues in the Corporate Contact Centre and follow up with a written response.
That's excellent. Thank you very much. Councillor Dedman.
Yes, can I just say that I've had quite a few inquiries about the blue badges, and as the councillor said, it is quite worrying for people, but the team are actually working on reassuring anybody that does get through to them that the blue badge will last, and I know that they're really responding very well. So, but it is worth keeping an eye on. So I totally agree with you, councillor. So thank you.
Thank you, Councillor Dedman. Any other comments? Any questions? Thank you very much, members, for your attendance, and have a good evening. I'm off to have my cup of tea. Thank you. Good night.
Thank you.